welcome to the Venari Podcast. As part of our HealthTech CEO series, it's a pleasure to welcome Ian Koons, CEO of Karoo Health. And we're going to delve into the story of Karoo Health and basically the importance of value-based care. But, absolute pleasure to have you here, Ian. Good to see you again.
Thanks, Christian. Thanks for having me.
I wanted to start, obviously, a little bit more personal and, at the beginning, basically kind of talking about your background and whether or not that you were destined to do something within healthcare.
I don't know about the destined healthcare. I grew up the son of a physician. So from a proximity perspective, I think I was destined more so, if there is such a thing, from an entrepreneurship perspective. I think 14, 15, my parents told me to get a job for the first time, like a real job. And my best friend and I, because we didn't want to get a quote real job, we actually created a curb painting business, and we would work half the summer and then spend half the summer at the pool. So I think from an early age, there was that entrepreneurship bug. From a medical perspective, I think being around medicine, being on the floor, seeing the time, the efforts, and the gratefulness of the patients for my father obviously did move me in that direction, but it wasn't certainly the intended profession. So I actually started my career in sports, and then ultimately shifted where I think I was meant to be within healthcare.
So what made you start Karoo Health then?
Yeah, so the Karoo story really started about 2 years ago now. So I was talking to a good friend of ours who founded Eligo Health Research, which is a well-known kind of CRO. And he was talking to me really about wanting to do something in cardiovascular care, really stemming from the disjointed, unsupported experience his dad had with cardiovascular disease. And it just so happened my best friend had a heart attack and passed away at 29. And so I always thought, is there a technology and or a care delivery model that I could create and or deploy that would have prevented the outcomes of the people I love? So the light bulb went off. My co-founder and I ended up doing kind of a deep dive on the current state of cardiovascular care. And through that, we got connected to Mark McClellan, the old CMS administrator, and he was commissioned by the American Heart Association, basically to say, why are outcomes getting worse, not better? When nephrology, oncology, all these other disease states have made notable advances, but the largest facing certainly the US, cardiovascular has not. And unsurprisingly, the results of that were there's no value-based care and kind of general misaligned incentives with providers. And so, we spent the better part of that year talking to countless cardiologists, and we would ask them one simple question, which is, if you had unlimited time and resources, how would you build this delivery model that actually put patients first, drove those outcomes and change? And they universally came back and said it had to be this hybrid delivery model, whereby we're really enabling value-based care from a traditional volume-based to a value-based through our wraparound services and the technology in which we deploy. And so we ended up launching our first state this year. We just launched today our second state, and are kind of off to the races.
Fantastic. And obviously we're talking there around kind of value-based care, and that is a term that gets thrown around a lot in US healthcare system. How do you define value-based care?
Value-based care is often, to me, like marketing. It's just a broad word that can mean so many things. To me, it really just means an alternative payment model to the current system, right? And how the mechanisms in which you go by can be varied, right? Whether the approaches that you take, there's lots of varies, but ultimately to deduce it to the most simplistic form, I think it's ultimately, creating an alternative payment model to, the current fee for service model in which we operate today.
Just thinking around where Karoo Health is right now, you mentioned that you brought on your second state as of today, so massive congratulations on that. But where do you see Karoo kind of in the next kind of couple of years? Like what's kind of the next steps for you?
Yeah, I think first it's proving that the model, the value-based care or alternative payment models within cardiology are in its infancy, right? But it's really the largest TAM that's ready to make that shift. And so, fast forward where we are, really is one of the most important, kind of certainly specialty companies in the US, right? Synonymous with cardiovascular care in America. And then having that far-reaching touch of touching, lives of Americans through, our services and the technology and our partners, both on the provider side and as well as the payer side.
Absolutely. And I suppose up to now as well, is kind of thinking about, your growth, like what's been probably some of the biggest headaches that you've had in the growth of kind of Karoo Health over the last kind of couple of years, and how have you kind of taken those on?
The barriers have been less so for the payers. I think that payers have this desire and recognition that they want to solve for cardiovascular care and spend, right? And that's both for the patients to do better by the patients, and then there's obviously a cost and a financial impact as well. But I think for us, early on, it's convincing and working with that, hey, this delivery model of enabling VBC through these wraparound services and the technology does work for you, the provider, and it's not going to jeopardize your income or day-to-day clinical workflow, right? But it's going to enhance your experience, revenue, and certainly the outcomes, most importantly, of your patients that need you the most, right? So our first partner, it was, and the ones that we talked to, it was, it's a problem because there's so much unknown, especially on how it works, how you get paid, value-based care, kind of the metrics, milestones within different markets and contracts are different. As we've solved that, those conversations have gotten increasingly easier. And now it's at a point where most cardiologists or several cardiologists around the country and health systems and payers are reaching out to us directly saying, hey, we want to do something. We just don't know how. Can you help amplify this model of care and kind of move us to the future of cardiovascular care?
Fantastic. How has it come to that point then when they're kind of reaching out to you? Is it just purely kind of word of mouth or?
Yeah, so I think it's word of mouth, it's press, but it's also their own internal, moral quandary of, hey, I'm seeing, a patient and it's 3 minutes and I'm saying, work out, be healthy, see you later, knowing that that patient is going to end up in the ED. For example, we had one of our cardiologists runs a very large practice, in New York. He had 55 cardiac admissions in a single weekend, right? When you ask him, they don't feel good about this. They say 50 to 75% don't need to, right? But there's never been within cardiovascular that wraparound services and the technology that streamlines that process for everyone, making it easy, leading to better outcomes, and ultimately that lower cost to the system that we're all, kind of striving for.
Do you have any advice for future founders, looking to start their own health tech company?
Yeah, I mean, listen, I think that there's a couple fundamental things. It's one, like do something that you either are an expert at or super passionate about, right? Because ultimately you're going to be spending all day, every night thinking about solving this issue. And if you're not, then you're ultimately not going to do it, right? And it's something internally that I've had to learn over the years of starting several businesses. And then, understanding too that, all my personal philosophy is that technology alone is not going to solve healthcare, right? And so what type of tech and people solutions that you can kind of create together to help solve, real life problems. And then really being uncomfortable. I think that's the real key, because ultimately you get told no every day, you get told you're dumb every day. And you just really have to let things roll off and just kind of continue to see the North Star and ultimately what you're trying to accomplish as an organization and as a human. And so those are kind of things that I think were really important, as well as, overly simplistic things that I had to learn the hard way. In my first startup, I should have fired people that were not, kind of high achievers in 3 months instead of 6 months. When, now that's a lesson learned of it's actually better to have those conversations sooner, for everybody, and to make sure everybody's kind of aligned and pushing in that direction, kind of, rowing the boat together.
Great advice there, Ian. And, it's been an absolute pleasure to have you on and kind of discuss and learn more about Karoo. But yeah, thanks so much.
I appreciate it. Thanks, Christian.